and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary Leblanc. On this episode of the podcast, I am joined by Douglas Peat, the Cultural Knowledge Broker, and Patricia Maecha, the Executive Director at Roots Community Health Centre. This is a CHC in Delta, British Columbia. Through the Systems Navigation Access and Partnership, or SNAP project, CHCs are increasing efforts to improve health and social systems navigation access to strengthen Canada's healthcare landscape and eliminate health disparities while improving population health outcomes. How are you both doing today?
We are doing very good, thank you. It's a beautiful day today here in Surrey.
Yeah, amazing. It's a very hot, lovely day here in Toronto as well. So I'm glad that we're both having some good weather. I hope we get to go outside soon and enjoy it from all of our perspectives.
Exactly.
So Patricia, I'll start with you. This is our first time having Roots CHC on a podcast, and we're really excited. So I'd love to learn more about the Community Health Centre as a whole, the community that you serve, and some of the programs that you offer.
So the community health, I want to start talking about Surrey, how is the issue with refugees here in Surrey and North Delta, because Surrey is the city that received more refugees in BC. So 50% of the refugees that come to British Columbia, they come to settle in Surrey. So 43% of the population of Surrey is made by immigrants, and 23% of people in North Delta. So it brings a lot of issues, social issues for the community. So in 2016, the Health Working Group, they meet and they were analyzing all these issues, and they decided to fund to start with Roots Community Health Center. It was a very small community health center. They have only 2 exam rooms in a clinic, and Dr. Hala, who is one of the founders, she worked for 2 days, and even she put money from her salary to make the Roots run. And then the Ministry of Health came and they funded 15 positions for extended our community health center. So the main population for us are refugees, newcomers. Lately, we have been working also with temporary workers.
Wonderful, thank you. Just out of curiosity, how new is Roots? What year did it open?
It was funded in 2016.
Oh wow, pretty recent.
8 years.
Yeah, that's very recent. Thank you. So as previously mentioned, Roots Community Health Centre received funding for their SNAP project, which I think is somewhere in completion. All of them are in different places at this point in terms of how completed they are. But I am curious if you could tell me a bit about what your SNAP project was, what you were able to achieve, and the impact that your SNAP project is having.
Sure. So I would say in a word, clarity. You see, the SNAP project provided an opportunity for us to look at what is being researched elsewhere and what is working and compare notes. And then we all learned from each other on that. Then we listened very carefully to our patients and learned from their experience, as well as 2 of our community partners and one of the larger ones, Options, and then the other one is Muslim Food Bank that does a lot more than food. And they're serving various needs of newcomers. And of course, we call that social determinants of health within this area: housing, food security, employment. But what we learned is the importance of providing navigation and how it still needs work to be done. Because for a rather confusing health system, along with referrals and recommendations for the critical needs, such as housing, food, employment, newcomers and refugees, they actually really do much better when they have navigation services. This brought to the forefront a series of recommendations that we are prioritizing at the moment. Then we're in the midst of planning how to get these things done. So if it's okay with you, I'll just mention 3 or 4 of the highlights. This isn't all of them. This is just a few of them. keep structuring to take time to listen to newcomers. You see, the reality is that when you come in with more complex needs, when you're coming into a new country, you actually need at that moment in time, particularly, more attention and more time to be taken. And they are still in the middle of their challenging process of settling with all that entails. So that's the main focus. How do you structure, unlike primary health care that sort of takes more of the immediate focus right now, what's happening right now, to look at the whole picture? Trauma-informed care, it's an increasing focus within all social agencies because people are recognizing the overwhelming aspect of trauma on the individual and also on generations, actually. So it's important for newcomers and especially refugees who have arrived after going through a very traumatic displacement to find themselves in a place where they're listened to and cared for, and that is very trauma sensitized. I hate to tell you this, but you already know this. Many are further traumatized by the healthcare system itself. And they're then also traumatized when they realize that living in Canada is not what they expected or sometimes have been promised. So this leads you to newcomer involvement. It's very important, we feel, to hire people who are dual culture. I'm an exception, a very small exception within Roots Healthcare at the moment, but I've worked for many, many years with people who are arriving. Those who speak the language and those who have lived through displacement and migration. So as we keep listening, as we listen to their reality, involve them in what they are focusing on, this will, and it does, alter the services we're providing. One interesting thing we came across is First Nations in BC. I don't know if you know this, but they now have their own health authority that stretches right across the province. And their understanding, like that of the community health centers, is that health is more than just providing primary care at the moment. It's holistic, involving all aspects of a person. So as they continue to develop, I believe we have a lot to learn from them. And their wider understanding of health mirrors that of many newcomers. And as well, learning from their wisdom in this area, which is proving, of course, so effective within community health centers, also is a part, I believe, of reconciliation, respecting their values, cultures, and their knowledge.
Wonderful. Thank you so much. That mirrors a lot of the other SNAP projects, a lot of things that we hear also at like various conferences here in Ontario. And there is an Indigenous primary health care, I believe, association here as well, doing some similar work. So it's nice to hear of that. And I have so many other things that I could say, but I really appreciated that that breakdown of what your project is. To me, it seems like this is a fairly obvious question, but touching on, developing and implementing organizational policies and practices to support system navigation, I assume I can tell why it was so important, but if you would like to elaborate a little bit on why for your clients, this is so important to be taking place.
Why is it so important for the clients or patients?
Yes.
There are several reasons.
Yeah.
One of the reasons is that they just come to Canada and they don't know many things, like how to get housing, where to buy the food, how is the health system here in Canada that is, in general, is totally different from the health system that they have in their countries, and how to settle in a new place where even they don't speak the language. So there are many barriers for them. So this project opened a door for them and is filling a gap that they have when they are thinking in navigating the health system here in Canada or here in BC.
Mm-hmm. And to bring in maybe that bad D word, discrimination, as we are looking at First Nations and some of their experience, how closely they unfortunately parallel some of the experiences of newcomers, where with the system of doctors right now that has gone more and more online, and so make a phone call. Can you imagine doing a phone call not in your own language about your own health considerations, not examining the larger picture that brought it about? That can be their experience. And if they come into the office, they tend to take more time. So because of the shortages of doctors in BC, many are just frankly not wanting newcomers as their patients. And we could tell you very difficult stories of the way some have been treated and assumptions that happens as well. So how do you address discrimination? I sort of like the First Nations approach in BC, where they're actually talking about culturally safe with humility. And I love the fact that they added humility, because it recognizes the importance of us carefully listening to each other as the process.
Absolutely.
And I think this is a strength of our community health center, because we are not offering services like 1 patient, 3 minutes, 5 minutes. No, we are seeing like 25% of the patient that a normal health center does.
Right.
Because we are giving them quality of time, quality of services, and with integrated and interdisciplinary team. So they can receive attention for all people who are working in the clinic, in the community health center.
Well, Patricia and I both have worked quite extensively with refugees. So is it okay if I take a minute to comment specifically upon that population? So refugees, it can be even harder. Like, unlike immigrants or migrants who have planned to come here and had prepared, they didn't plan or even chose to relocate to Canada. They had to flee from war, danger, persecution, loss. Imagine having to leave all you have known, leaving behind your housing, your job, even family. And those families still are in danger. This is what they have lived through, and through trauma are currently living through as well. So when they arrive and they're trying to settle, they find themselves living in a small apartment, having to rely on food banks. A lot of them are living in poverty for the first time. A lot of people don't realize that they came from settled lives, and now this is the first time they've experienced deep poverty in Canada. As well, they're feeling out of place and very disempowered. So agency, giving them agency through navigation is incredibly important. As well, health concerns take a back seat to their healthcare. Because if you're finding housing, you're finding employment, you're just trying to access food, and you're trying to develop community, your health concerns you tend to push aside. And that's not good. And when they do reach out, our health system isn't really adapted to meet their needs or listen well, unless they come to us, of course. So those are some of the factors. So I think it's hard to overemphasize the importance of having a caring team who's navigating, who help you understand and navigate the health system, to have people who take the time to listen, and to have the interpreter who's speaking your language.
Yeah, we have cross-cultural health brokers, and they are assisting our patients with interpretations at the community health center, or with appointment with the specialist, or with the pharmacy, or whatever service they need. We are helping them, and it makes easier for them to navigate not only the health system, but all the society, to integrate better into the system, into the Canadian system, into the Canadian society.
Absolutely. I think in the majority of these episodes, I've said that I, as someone who was born in this country, find the healthcare system difficult to navigate. I cannot imagine what it's like when you, as you've like perfectly highlighted, have uprooted your life and you come here, and there's a lot of stereotypes and misconceptions about why you're here. You might be facing racism, discrimination, all of these different things. And then you're trying to navigate finding, you know, your basic needs and getting those fulfilled, when like I've experienced trying to, have therapies in different languages and have that not work out for me. And I can advocate for myself. I am here, so I understand that it can be so much more difficult than the difficulties we even experience. So this project has really highlighted that for me in a sort of lovely but not so lovely way. You both through the project, I'm curious if you've experienced any challenges while trying to implement these navigation tools and how those were addressed, and also other successes that you might want to highlight through this project.
Okay. Ensuring all staff have the training and understand the resources they're referring to. Wouldn't it be wonderful if everything was simple and streamlined between all organizations? That would be a bit of a, what was that, Havana or Havana?
Hannah?
It's Hannah. No, it's it's okay. It was one of the heavens. I forget which one it is. As all the staff participated, they definitely became aware of issues and gaps, and they also became more aware of some solutions we can bring to the gaps. But frankly, we have a lot of ways to go in order to make sure things are smooth, and also to have the capacity to follow up to make sure that people are actually getting the services they need where we refer them to. And so we're working together with community partners to improve the linking to services back and forth.
And one thing that for me was so beautiful implementing this project is that almost all the staff at the community health center participated. And it was very good because they did the interviews and surveys in their languages.
Yes.
And then they translated these interviews and surveys to English. And people felt so comfortable. And in addition, they could get the real information and the gaps and the issues that our patients are facing. So they are really aware about what are the issues that we need to bring solutions. And maybe also they are like brainstorming about how we can do it, how we could do it.
Well, thank you. I'm also curious if your community health center has plans to be able to sustain some of this work after the project has fully wrapped up and completed.
We are still implementing the findings. With the SNAP project, we developed some recommendations that are for the community health center itself, but also how we are going to engage the community and the community organization to work together. Mm-hmm. And we also developed some policies specifically for the navigation system. And there is a lot of work that we have, and this is a continuing work. It's not like the grand finish and that's it. No, this is a continuing work that we need to do to improve in some ways the life of our patients, the life of refugees and new immigrants and migrant workers.
Mm-hmm. And I'm curious, because I'm fairly new, are most of the community health centers charities as well?
That's a great question. I also want to highlight, I usually don't get asked questions on my podcast. I'm so honored to be asked a question. I don't believe that we're typically registered charities, but everybody is a nonprofit, like community governed. And the funding, which is a little bit complicated, but because we're federal, we hear about the funding structures from all different provinces, and they're all different. So sometimes it's federal, sometimes it's provincial, sometimes it's grants, and they're all sort of piecemeal. For the SNAP project, we've interviewed some that it was they don't even have physical buildings. They partnered with other organizations and nonprofits and shelters to implement their projects and connect with community, but they don't have like a hub or a primary healthcare team. So CHCs look different across the country. And so the SNAP projects look very, very different across the country. So everyone was able to achieve various different things all around. And I think like sort of what I was highlighting before, everyone has been able to attest that the healthcare system is so difficult to navigate that this money helped them build something, and the majority of them are having lasting impressions, whether it's they're continuing to sustain the people that did like knowledge brokering or healthcare brokering, or they're building physical resources, online resources. A lot of things are going to be around for a long time, which is wonderful, because obviously the money was finite.
Yeah. No, I was excited after I started to find out that Roots Community Health Center had actually gone the additional step to get their charitable status, because that's part of my background. And I believe that within our society, as we continue to open the doors, what is it, 500,000 that the government has announced that they want to welcome in the next year or so. That's a lot of people. Then it behooves our society, and I believe there are people out there willing to reach in and support that initial step of settlement, the initial step of getting used to our society, and the initial, especially the needs of newcomers.
Absolutely.
The ideal, of course, is then to transfer them, is that the right word, or refer them to primary health cares in the long term, so make room for others, which is easy to say, difficult to do.
Of course.
So, yeah.
That was discussed earlier, this idea of sort of graduating from one project with their SNAP person to then be able to just see their primary healthcare team and sort of move a little bit past the initial systems navigation portion. But again, more easily said, not easily done. So a theme for my day today. Patricia, I did want to ask you, and we did touch a little bit on this in terms of the charitable status and the funding, what increased federal, provincial, or any type of increased investment would allow either Roots as a community health center to achieve, or even what it would allow for your SNAP project to do with just that increased amount of funding?
The Community Health Center it's funded by the Ministry of Health of British Columbia. What I see and I feel is that they are doing a great job with community health centers here. And they fund and even they give like support through the implementation of the services that we need to do in the long way. But they can, even they are helping us to get a better place, because the place where we are now is a small one. Today we are in the library, for example. And it's part of the issue that we have. And this is the reality, yes? So because of the population that we are serving, we need more support from the federal government, because it's what Doug was saying, that the government developed some policies like, okay, this year we are going to bring 450,000 newcomers or 500. And every year they are increasing the number of newcomers, and also because of the situation in the world, more refugees are coming here because this is a safe country. So we really expect that the federal government take more like responsibility about that, because it's about the health system. So we can bring, as a government of Canada, more people that I am sure they will improve our country, but also we need to balance. If they are bringing more people, we need more funds so we can give them the services that they are expecting and that they deserve. So from the federal government, we only receive a grant through other organizations, but it's funded by the federal government, but it's a very small grant, and it's for serving migrant workers or temporary workers, because their conditions also are really bad. So we are trying to help them, and we develop health fairs near to the farms where they are working, and we offer health services and other services during that day. But this is like only one point in all this line, yes? So, yeah, we will like that the federal government help us, not only our community health centers, but others that are working with refugees and newcomers.
And, when you look at the migrant temporary farm workers, in BC, it's approximately 30,000. Across Canada, it's much more. And for the first 3 months, they do not come in BC. I believe they do in Ontario, covered by health. They're expected to come with their own health coverage for the first 3 months. And what they find is many of the people coming in from Mexico and other countries under these agreements, they come back to the same place year after year after year. So really, this is their second home, but they really don't have much chance to integrate, and their healthcare needs aren't paid much attention to. Is that a fair
Yeah.
statement?
Yeah, yeah.
So that's another area.
Yeah, so what I seen is that when they develop policies must be supported.
Mhm.
They bring more people, we need more funds to give, especially health services to the people that are coming here.
Absolutely. I mean, if these places are their second homes, I mean, of course, they need the access to the services. And I mean, imagine waiting 3 months and just assuming that these people have coverage where they're coming from as well. So it's extremely complicated. But again, overarching, I think, goal of that question is increased funding would certainly help you, be able to serve the community in a much better and more holistic way. And that's what we hear, across the board from all of our community health centers. Douglas and Patricia, I want to thank you both so much for speaking with
Thank you.
me. If anyone wants to learn more about Roots Community Health Center, I'm just curious if there's a website or a place online where someone might go to learn more.
Yes, however, it's about to be completely redone. So just to let you know that
Okay.
it's rootshealthcare.org.
Amazing. Perfect. That'll be on the screen, but everybody go back and check on it in a however many amount of months or time when it's all revamped. And until then, I mean, they can check through us. I'm sure I'll be sharing on social media different things that you do. But again, I want to thank you both so much for participating in the SNAP project and doing the amazing work that you're doing in British Columbia, and for taking the time to chat with me today.
Thank you so much.
Thank you.
Thank you. Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.